Hello, everyone, and welcome to our data briefing on safeguards for youth. My name is Lori with the Lucille Packard Foundation for Children's Health, and I will be moderating today's briefing. We'll start with a few housekeeping items before we get started. The briefing will be recorded and archived on our website and shared with all registrants via email. Our recorded briefing is scheduled for 30 minutes, but we will stay on afterwards to answer questions. So please enter questions in the GoToWebinar question box. Joining me today is Troy Nichols, Senior Training and Consulting Specialist at the Child Abuse Prevention Center. Troy will share best practices in promoting protective factors for families and children and share trauma-informed approaches to care. He will also compare frameworks for describing protective factors and supportive services and provide additional resources that can support your work on behalf of children. On Kidsdata.org, we have over 600 indicators that describe children's health and well-being. We have been effective at describing the issues that raise concern about children in California, but now we're turning our attention more explicitly towards solutions. The best way to address issues is through prevention and by protecting children before an issue has serious consequences. This could involve building resilience and strengthening families. And if problems do occur, then a robust system of services can help minimize impact on children. The goal here is to maximize short-term and long-term health and well-being for children. With this in mind, the Kidsdata team recently compiled indicators into one place that describe protective factors and supportive services. We're calling this compilation Safeguards for Youth, and we have created a web page on kidsdata.org so that you can easily access all these data. The Safeguards for Youth data come from 15 different sources, and we list many of them here. They include data from federal and state agencies such as the California Department of Social Services, from organizations such as PPIC, Public Policy Institute of California, and surveys such as CHECS, the California Healthy Kids Survey. The data are organized into protective factors and supportive services that you see listed here. Protective factors include preventive health care, such as being a part of a medical home, a strong start in education, such as having access to childcare, and a nurturing school community, such as having caring relationships at school. Supportive services include support for health challenges, such as access to mental health care, services to address abuse, such as foster care services, and programs for families in poverty, such as the WIC or CalWORKS program. This slide here shows you a screenshot of the data page that you would see on kidsdata.org for Safeguards for Youth. You can access these data as it's shown on the bottom there, kidsdata.org/pages/safeguards-data. And then on that page, you can click on any one of these headings here to jump to the relevant data links. For example, under Protective Factors, if you clicked into Nurturing School Community, then you'll jump to this section on the page. And here you will see a list of all the indicators associated with this particular protective factor on kidsdata.org. And then if you click into any one of these blue headings here, you would get to the actual data tables and be able to create your any kind of data table or figure that you want about those data. So this new Kidsdata webpage offers you a comprehensive single source for finding data about positive approaches for addressing issues of children's health and well-being. And now we'll hear from Troy, who will tell us more about the protective factors for youth and families. Troy?
Good morning and probably good afternoon for some of you. My name is Troy Nichols. I'm the Senior Training and Consulting Specialist here at Strategies 2.0. Which is housed at the Child Abuse Prevention Center of Sacramento. I really appreciate that we were asked to be a part of this webinar because we have had some connections with Kidsdata in the past, utilizing them to develop various tools that we have. So when I realized what we were doing and needed to find some common threads, it was really exciting. So in reading and preparing for this, I continuously looked for that common thread, and when the advertisement came out, I finally found it. The common thread is developing this prevention mindset. And I love when I get a set of words or informations or definitions to further define the work that I do. I've never thought about it from that perspective. So I thank Kidsdata for that, because it really begins to give clarity to the work that we do here at Strategies 2.0, because we are very much a part of developing a prevention mindset with the collaborative partners that we work with. It's not only that we develop a prevention mindset, but we are also developing what we should be promoting, coming from a strengths-based perspective. And with that, there are a few areas that we utilize in developing this mindset. A trauma-informed approach, which is woven through much of what we do. We encourage the individuals that come to our trainings or that we do consulting with, that trauma-informed care and a trauma-informed approach has to be woven throughout what you do. It should be in your supervision. You should have a trauma-informed lobby. Your marketing and your marketing materials should have a trauma-informed approach. So one of the strategies that we use in developing a mindset is this trauma-informed care. Another is our collaboration with the Center for the Study of Social Policy. Slide. And we're going to talk more about that in detail. We collaborated with the Center for the Study of Social Policy quite a few years back in developing and assisting with the development of the 5 protective factors, the Strengthening Families model. And it was very interesting when the protective factors were presented from Kidsdata and how much they related. The 5 protective factors, which we're going to go through in detail, they work to increase family strengths, enhance positive child outcomes, and reduce the likelihood of child abuse and neglect. Some of you may be familiar with them, so we're just going to give a brief high-level overview. Slide. These are a list of the 5 protective factors that the Center for the Study of Social Policy developed in the prevention of child abuse and neglect: concrete supports in times of need, social connections, knowledge of parenting and child development, social emotional competence of children, social as well as parental resilience. Slide. So when I was asked to provide this information, I thought about not only just giving a definition, but talking about the presence of the skills that it takes for this particular protective factor to be a part of our families' lives. Center for the Study of Social Policy developed these protective factors by doing research on early childhood education and families who were embarking on that, and developed an idea of these families who had strengths, who were moving in a positive and healthy direction. What were some of the things that they were doing to develop these skills as well as maintain them? And that's where the basis of the protective factors came from. So as I mentioned, talking about the presence or absence of it is often how we go about providing information in our training. So in looking at concrete supports, we realize that all folks need a support system, both formal and informal, and have the ability to identify and receive basic necessities, understand what their rights are and what they are due with regards to services. They have the ability to ask for help. So when we see these characteristics, we begin to realize and can help promote concrete supports. Slide. The next protective factor, social connections. Needing to have a social network, a network to level set with regards to your parenting. I often tell the story when I had, when my son was young and he had damaged one of the crown moldings in my house, my social connections helped me out. He was young and he had carved something in there, and good friend of mine, a social connection, said, "Hey, my kid burned the garage down at his age. That's nothing, you know." So social connections can not only provide us with supports, but they can help level set our parenting sometimes. And at that time, I was like, hey, yeah, you're right. It's not that bad. Maybe I should have a different perspective on it. It helps in building trust and feeling respected. And families, friends, neighbors, whoever provides you with something that you may need, not only in crisis, but in good times. Slide. Knowledge of parenting and child development, really important aspect in limiting some of the anxiety and frustration that parents sometimes experience, especially new parents. It allows parents to have an accurate understanding of where a child should be, and if they're not there, what we need to do, and if we are there, how do we celebrate that? Slide. Social emotional competence of children, and this is the one protective factor that directly addresses the child and their interaction with the family, but also their behavior. I often describe this as your ability to regulate your reaction and responses, your regulatory behaviors. How do you go about developing relationships and having positive communication skills, especially around your emotions? Next slide. Parental resilience as our final protective factor. I feel like, and many do in the research, that this is an umbrella for all protective factors, that resilience and the ability for a family to pick themselves up and continue moving in a strengths-based manner. You have to have some level of resilience, and it's really important in the work that we do. So with these 5 protective factors, they are in many ways, the foundation for us with regards to our training around developing this prevention mindset. I also want to talk about the idea that there's a parallel process that goes on. Slide. So not only do we have these protective factors that we work with families, I have begun to present to agencies and various collaborative partners that we also have to have our protective factors for our staff, and the parallel process of supervision, the work that happens with our leadership, our boards, and hopefully ultimately our funders, that we also have a protective factor approach to it, and that we realize that concrete supports are also needed at work, and we need peer and staff connections, and knowledge of parenting and policies and knowledge of policies and procedures and staff development, social emotional competence of staff, and staff resilience. So with that, the definitions that we're given for families can directly be applied to the work that we do within our agencies, because we can't ask our folks that are in the streets, boots on the ground, to provide services that we aren't providing within our own walls. So the parallel process is extremely important in the work that we do. Next slide. So I mentioned that the protective factors was one of our foundations that we present in our trainings and in the work that we do. And another is the trauma-informed approach. Oftentimes I let training participants know that if there's anything that you leave as an overarching idea with regards to a trauma-informed approach, it's the idea that we spend a lot of time talking about what's wrong as opposed to what happened. We spend a lot of time treating the signs and the symptoms as opposed to treating the trauma. So delving into what happened during the research, becoming intimate with the details of a child, a family's past, is extremely important. And it's a build on top of those protective factors. So in order to develop and get to those protective factors, we've got to address an individual's trauma. What have they gone through? What could be potentially standing in the way? Has their self-esteem been affected by their trauma? Because we need a high self-esteem to make change, to move in a positive direction. So having a trauma-informed approach begins to allow us to bring families into a better understanding of what could be standing in the way and how they work with it. Slide. I just wanted to highlight the 6 principles of a trauma-informed approach, and we subscribe to the SAMHSA model. Substance Abuse Mental Health Services Administration is one of the preeminent entities now in trauma-informed care. And these 6 principles have been developed to begin to guide how we assist the family in paying attention to past traumas, challenges of present, and how we move forward into our future. So safety, and we're talking physical, mental, environmental safety, very important aspect, and making sure that we care for that with our families. And remember, this is a parallel process, so we need to care for that within our agencies. Do we have a safe environment to have supervision? Trustworthiness and transparency. Important aspect to this is sometimes just admitting when you're wrong, knowing that I have to share accurate information, and when I admit when I'm wrong about something, it can show my vulnerability, but also begin to build that trust. Another aspect of a trauma-informed approach is peer support. And I'm going to date myself here. I don't mean Flavor Flav. You don't need a Flavor Flav in your life. For those of you who don't know, in the hip-hop community, Flavor Flav was a hype man. He made millions of dollars by just hyping up the crowd. Well, you don't need that as far as your peer support. You don't want a hype man. You want somebody that's going to really level set with you and have conversations about the hard work that we do and the trauma that we see daily, the vicarious trauma that we experience as workers. So peer support becomes vital. Collaboration and mutuality, it is the direct connection to that parallel process. So not only the parallel process that I speak about from supervisor to worker, now we're speaking worker to family, and that collaboration has to be done in a way that that family is in charge, but that we're doing it in a mutual manner. Empowerment, self-esteem is needed to make change. Empowering a family to have their voice and choice, and knowing that they are in charge of the goals and the destiny that we're trying to achieve. And finally, culture. How do we do our own trauma? What does it do to us? How do we handle it? What are the goggles that we wear? How do we define trauma? What's our operational definition? And what's our operational definition of healing? So we have to establish that to have a better understanding of how to help a family. Next slide. So with that, we've talked about the protective factors. We've talked a little bit about trauma-informed care. And what I began to realize is there was already a connection between the protective factors that our safeguards provide and the protective factors that Center for the Study of Social Policy has developed. One of the protective factors on the safeguard side is preventative health, directly related to concrete supports in times of need. So if we're trying to promote preventative health care, we want to make sure that we have an understanding of what concrete supports mean and how do we develop them. Strong starts in education, social emotional competence of children, having them understand how we go about acquiring information. How do we conduct ourselves within the classroom, within those relationships? A nurturing school community is social connection. So whenever we talk about our community, our work community, our faith-based community, our school communities, we're talking about the connections that are needed and promoting strengths-based connections. Slide. Next set of information were the supportive services. And on the right-hand side are the supportive services that we here at Strategies 2.0 promote, work with, and continue to develop. So support for health challenges, our early start family resource centers. So we strongly encourage family resource centers to have that first 5 mentality, to come in at 0 to 5 and begin that process of helping with developing health physically, emotionally. Services to address abuse are the child abuse prevention centers across the state, as well as county prevention plans. We have embarked on an effort through the Office of Child Abuse Prevention, who is our funder, in assisting counties in developing their prevention plans. So what we have done is brought together various players in counties across the state to talk about how do we collaborate, how do we have a mutual set of goals in developing our prevention plan. And finally, programs for families in poverty. Our family resource centers provide services throughout our community, services around acquiring jobs, acquiring diapers, acquiring housing, so various things that help to limit the ills of poverty, as well as training and implementation of the skills needed to assist the family. Slide. So I included this because quite a few years ago, this became a part of our training, and Ellis and Dietz, as you can see at the bottom, the documentation, began to talk about a shift in focus. We are very aware, I'm sure, of our adverse childhood experiences. And what Ellis and Dietz began to speak about is we have spent a lot of time in treating the leaves and the branches. And there are roots that oftentimes may go unnoticed. And this really hit home for me, spending a good 20 years of my career as a foster care social worker and realizing that I had helped a lot of families and a lot of children, but put them back down into a community that was still broken. And a lot of the work that we had done disappeared because we must both treat adverse childhood experiences, but adverse community environments. So this picture really hit home with regards to the work we do in more support of promoting a prevention mindset. Slide. So what I've presented so far are the things that we provide as far as services. We go out into the community around training and consulting. And again, promoting the Center for the Study of Social Policy's 5 protective factors along with a trauma-informed approach. What I'd like to do next is point out some of our resources with regards to our website. So our website, strategiesca.org, and I'll give you that again at the end of the presentation so that you can remember it, but strategiesca, as in California.org. So the first thing that came to mind when I was asked to do this webinar was our Building Community Resilience Toolkits. And we collaborated and used information, again, from Wendy Ellis and William Dietz. They have a community resilience model, and it's extremely innovative and transformative. And it's approach that helps to go into communities and do needs assessments with regards to increasing their resilience and developing strengths-based approaches. There were 4 toolkits that were developed. The first one was based on a shared understanding. So going into the community and beginning to have a shared understanding of what the challenges are, what are the pain points. The next was a state of readiness, the next toolkit. And it speaks to where are we in the process of getting the work done? Are we prepared? Do we have the resources? Do we have the mindset? Cross-sector partnering is the third one. How do we go about getting the right players at the table at the right time to make the right decisions, to make the right changes? And finally, an engaged community, and that speaks to sustainability. Once we develop some resiliency within our community, how do we sustain it? These toolkits talk about assessment, readiness, implementation, and sustainability, and are really important aspects to getting into a community and actually doing the work. Just wanted to quickly highlight some of the tools that were in, for instance, the first toolkit. There are a few tools. The first one is organizational perceptions of the community environment. How do we go about creating an understanding and facilitate dialogue around agencies' perceptions? So again, how do we bring our community in and see what they see in order to develop the goals to meet the needs? Another tool is understanding community priorities. How do we increase awareness and facilitate a discussion on how your agency views community's priorities? What are their priorities? Do they align? Sometimes our priorities are not only dictated by the community, but they could be dictated by our funders, and do they match up? So a set of tools that go along with developing this prevention mindset, going out into our community and doing our community work. Slide. The next resource is our knowledge to action briefs. And I love the title of this because it's just that, providing information so that we can go out and do something. This particular knowledge to action brief speaks about equity and social determinants of health. And you can only see the front page. It's a 2-page document. You can, again, access them on our website. But what it provides is information with regards to the topic. So it provides information on equity and social determinants of health and how it's affecting our communities and how it's affecting our children and families. The second page begins to speak to what do we do? How do we go about providing information on these topics so that we can help families move in a positive direction? Slide. Also wanted to point out another resource. We are a training arm, and I've highlighted the Pair of Aces Building Community Resilience training because it's directly related to what we're doing and what we're talking about. But many of our trainings also relate. Protective Factors Deeper Dive. We have a Facilitating Change Talk training, which is based in motivational interviewing. Home visitation trainings, and various others that provide information to the field so that they can begin to assist families in their development. Slide. Finally, I'd like to speak about our webinars. We provide webinars that I am not usually a part of, but after being asked to do this and having done ones in the past, I'm definitely going to begin to, and ironically, I've been asked to do one using Kidsdata in about a week. So really important aspect to what we do, information that we provide. And you can see a list of some of the topics that we provide information on. Final slide. So in closing, we spoke about our protective factors, a trauma-informed approach, as well as bringing an idea of culture in to the work that we do. Our 5 protective factors provide us with a framework to begin to work with families to set goals to achieve a strengths-based outcome. In trauma-informed care, we pay attention to the obstacles, the things that may stand in the way, the history of the family, not what's currently wrong, but what happened to them. And finally, the connection or the intersection between the two, the work that we're doing and the work that Kidsdata is doing, information on providing stats and providing documentation to identify the pain points, and then utilizing the services that we provide to address those pain points. That marriage can provide some strong outcomes with regards to the work that we do. That's all I have.
Thank you, Troy, for sharing your insightful thoughts on elevating prevention in your work, in all of our work. That's really fantastic. That was so helpful. Please share your thoughts by emailing the Kidsdata team at kidsdata@lpfch.org. And this concludes the Safeguards for Youth briefing.